You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions. Today, we welcome Jamie Bie to the show. Jamie is a highly experienced musculoskeletal sonographer and the owner of Learn MSK Sono. With several years of hands-on expertise, she has not only written a comprehensive textbook on musculoskeletal sonography, but has also designed specialized courses aimed at advancing practitioners' skills. In this episode, we will explore the intricacies of MSK sonography, discussing its critical applications, the evolving techniques within the field, and Jamie's key pieces of advice for clinicians seeking to become skilled in the modality. Stay tuned for this enlightening conversation that promises to enhance your understanding and practice of musculoskeletal sonography.
Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we have been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel. And now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the U.S. Learn about our range of ultrasound solutions on our website by visiting us.edm-imaging.com.
On this podcast, we're no strangers to talking about ultrasound imaging, but one area that we haven't talked about yet is musculoskeletal ultrasound. Here today to help us change that is Jamie Bie. She'll be giving us a deep dive into the world of musculoskeletal ultrasound. And I must say, Jamie is the right person for the job. She has an extensive track record of ultrasound education. She is the founder and owner of Learn MSK Sono. Additionally, she's the author of Musculoskeletal Ultrasound, a comprehensive guide to musculoskeletal ultrasound imaging and interventional techniques. She's an e-course developer, as well as a CME question writer at Pegasus Lectures. Jamie is, of course, also a sonographer herself. She is currently the senior musculoskeletal ultrasound specialist at Columbia University, New York Presbyterian Imaging. Jamie, thank you for being here today.
Thank you so much for having me.
So as I mentioned in the beginning, MSK ultrasound is not a topic we've really touched on yet. We've discussed a lot of echo, pediatrics, but nothing on MSK. So I think it would be helpful for the listeners to understand a little more about what led you to MSK specifically. So could you share your personal journey in musculoskeletal ultrasound? What inspired you to embark on this career path?
Sure, absolutely. So I began my ultrasound career about 18 years ago, and I started off by getting all your general registries. I'm registered in abdomen, OBGYN, breast, pediatrics, vascular, and I knew that I wanted to tackle MSK, but didn't really have an idea of how to do that at the time. And eventually I stumbled upon a good opportunity. So when I was working full-time for Columbia back in 2012, I was also working per diem for Lenox Hill Radiology, and I was presented with an opportunity to leave my job at Columbia and come on full-time at Lenox Hill Radiology to be mentored by a young, very talented, smart physician named Greg Wilde, who had just done a fellowship at HSS in New York City, and he was very busy doing all the exams himself and really wanted to look for a motivated sonographer to come on board so he could teach them what he knows, and he was looking for someone that would put in the same effort that he was putting out. So it seemed like a great opportunity to me. So Columbia gave me their blessing at the time, and I left that job and went full-time to Lenox Hill to take on the opportunity of mostly training on the job at that time. So when I started off, I was mostly just learning from my mentor, and I was, kind of a deer in the headlights. I didn't know any of the anatomy, hadn't learned any of it in school, didn't know the scan technique, didn't understand it. So I quickly signed up to take the Pioneer ARDMS registry in MSK, which was coming out in 2012. It just happened to be the perfect timing. So I thought that that would kind of help motivate me to start studying. So I signed up for that when I still didn't know much about anything. And then while I was learning on the job from my mentor, I was studying for the registry. I was gaining the hands-on experience with the patients. And one thing I did is I wrote everything down from like what he was teaching me with scan technique. I was writing down the protocols. I was writing down tips for myself of like how I could remember it. And I just had a tremendous amount of writings at the time that were really personally for myself at the time. At that time, they saw that I was, really taking it seriously. And I ended up passing the Pioneer Registry and kind of felt a little extra level of confidence, but then I still felt like I needed more hands-on experience. And at that time, I got promoted at Lenox Hill to be into an educator position, where I decided to write the department protocols for ultrasound. So this is when I took all the writings that I had written for myself and kind of fine-tuned them into a way to like teach them to other sonographers at the time. So it helped me to kind of organize my thoughts and kind of write it in a manner that was easy for technologists to understand. So I kept writing, and that repetition of writing was helping me learn it and then helping me work it out in my head. And then the next thing I do is I started programming the ultrasound equipment with the protocols, which I highly recommend to anybody that's learning, because again, just writing it out in an organized fashion and writing out the words that you could see the spelling. One of the things that's really hard with MSK is learning the anatomy. So if you're writing it first and then seeing it in front of you every day when you build the protocol or the annotation into your machine, you can build it in the order of that you're supposed to take the pictures, and then you're seeing it every day. And it's also helping with time management. That was something that took my skills to the next level, is just writing. And then soon after that, my mentor was thinking we were onto something, and he was like wanting to do a CME course. And I kind of had looked into that, and I thought like I didn't know how to kind of start from nothing at that point. So I had sent a message to Pegasus Lectures and asked if they wanted to put out any MSK products. And they had said it was perfect timing for them, that they were really interested in it. So at that time, I sent over my, kind of as my resume, I sent over my department protocols. And they were like, I really like your book. And I was like, oh, I never thought of it as a book. So they actually really believed in me and gave me the opportunity to write a book about it. And so I had all the writing, but I decided to, take it up a notch and include anatomy reviews and protocols and ultrasound images and step-by-step instructions. So while I was doing that, in conjunction with that, I started developing the e-course that you mentioned with my mentor, and we created a 51-hour e-course of anatomy lectures, pathology lectures, and scan labs with me demonstrating it. And that's an e-course that can be good for doctors or technologists. It's Category 1 credits. And just all that repetition, like my journey is unique in the fact that like I wrote so much about it that I don't think I can forget it, even if I tried to forget it, because I just wrote so much about it that it was ingrained in my mind forever. Right. So after all that work was complete and Pegasus released my products, I just felt like I had made it this far, so I shouldn't stop now. Like, what can I do next? And just one day over brunch with like my husband and a friend, we were discussing about how I was teaching MSK at like conferences for other companies, and I had ideas on how I could do that myself, and I wanted to just give it a shot. So that's when I developed Learn MSK Sono. Kind of came up with the logo that day, kind of decided I was just going to give it a shot and see if people showed up. And they did. And that's kind of how I got started. And I know it's a really unique pathway that not everybody has the opportunity to learn from a mentor. But that was something that really helped me. But like the concept is still there of like going to a job, trying to latch on to somebody who knows more than you do, like a physician, something like that, studying for the registry and just kind of making the most out of all your opportunities and practicing and kind of going to courses and getting books that you like. And now I've kind of grown this company over time, and I've carved out a unique role for myself at Columbia, where I'm the senior musculoskeletal specialist. I perform the MSK ultrasound. I teach it. I go out to offices and I market it and bring business to the practice. And I'm traveling all over the country to provide on-site training to different hospitals and kind of catering to whatever their level of experience is or whatever their needs are. And it's been a really great journey. And I talk to people along the way and kind of see where they're at and try to give my advice as I go on like where they can start with what they have.
Wow, that's incredible. I must say I've heard several different sonographer career paths at this point, and that has to be one of the most unique, I will say. You have a great story for sure. Incredible how you went under that mentorship is basically what led you then to develop that education side, right?
Yeah.
And it's crazy how you already basically had a book in itself written from yourself, just from your practice. That's incredible. So is that something that you recommend that people really take their education or their practice so personally that they write it out or just study it to the point where they're able to teach others? Teaching is learning, isn't it?
It is. I mean, because when you're teaching, number one, you're working it out while you're doing it. You're adapting to it while you're adapting to different scenarios while you're doing it, different people's education levels. And it obviously you care because you want to do a good job when you're teaching. So
Exactly.
someone's looking up to you and looking to you for that information, and you want to give them the best possible training possible. And I just have always been really passionate about it and took a lot of pride in my work.
Excellent. Moving on to or continuing the conversation more so on the career path, I know that for other specialties within sonography, the career path isn't always clear. For example, recently we had a conversation on the need for more MFM sonographers, but how the career path really, or the pathway to get the MFM credentialing really is not clear. And that's something that the societies are working to fix. There's a lot of movement to make it something more established. When it comes to MSK, though, I feel it's not as uncertain, but perhaps I'm wrong. So I'd want you to give us your insight on this. For individuals who are aspiring to have that role in MSK, what educational pathways or professional development opportunities would you recommend? What's your insight in that?
Well, first off, this can be challenging because I know people choose jobs for a lot of different reasons, but I think that it's really important to work for a company that either has an established MSK program, that has a physician who can read the cases and is willing to give you the opportunity to work side by side with them to develop your skills and grow the practice. And I know that that's not always the option for everyone. Some people want to do it, but they don't have the right opportunity. So in that case, I think you at the very least have to work for a company that will support you and invest in you starting this up at your company. So I would say that if you're not working for a company that supports this journey, you're kind of going to hit a wall. Like you can only do so much if you don't work for a company that either wants you to bring this to their company or wants to help you grow this at their company. And then when you do work for a supportive place, you always want to take any opportunity that's presented to you to learn new things. My biggest advice is don't be afraid to look inexperienced. Even the most experienced sonographers feel like students when they're learning MSK because we weren't taught it in school.
Right.
We don't know the anatomy. And so even someone with 30 years of experience is going to walk in feeling like a student, and just to kind of throw that out the window and not be worried about that, because what people are going to see in you is your desire to learn and that you're hungry to like do a good job and that you're taking the steps to learn it. I definitely think that you should attend as many hands-on training courses as you can. As I mentioned, I offer these, but I'm not just saying it for that reason. I'm just saying because you have to get a more structured format also in addition to it. So the format at my workshop is for me to side by side to perform like a live scanning demonstration with graphics up on the screen, because I think it's really important to, while you're looking at an ultrasound image, to see how the structures actually lie in the body, so you understand why you're holding the transducer that way. So it's really important to kind of correlate with the actual anatomy in the body, and also so that you could see what it's supposed to look like. There definitely are not a lot of resources out there to learn what pictures you should take. That's why I wrote the book of like step by step, what the picture should take, how to hold the transducer, where the knot should be. All these different things are important. My book is like made to be a bedside manual where you just flip to that section and it tells you how to do the exam. And but I just think like try to convince your job that this is where the future of medicine is going, that you're going to have to learn how to do these things to keep up with the rest of the people. Try to convince them to send you to courses, try to convince them to like let you get your hands on these patients, encourage them to start taking these patients, grow a team there of like radiologists and technologists that are all on the same page. They're going to work together because it definitely takes the physician-technologist relationship to be able to grow this part of your practice. So if you're not working somewhere that offers that, then you might have difficulty. So you might have to just take the plunge. Like, don't be scared. Work for a company that's going to help you grow.
Right. So the support from the company or the establishment, you would say, is very important. It's critical.
So many people reach out to me and they're like, I want to learn this, but I don't have a radiologist or I don't have patients. And you're just going to hit roadblocks that way because there has to be someone to read it. In order to take the register, you have to have 150 cases of MSK to be like, or they can audit you. So it's very difficult to do without the support of the organization you're working for. Like you can start by studying like picking it up on your own, but eventually you're going to have to bridge that gap of like working for a company that wants you to grow this part of it.
Such good advice. If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStyle Ult can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStyle Ult. Visit us.edm-imaging.com/TriStyle. That's TRISTEL. And now, back to the show. So we've covered what led you to MSK, how other sonographers can get there. Now I want to pivot a little and just discuss the value that MSK Ultrasound brings to the table. Because you have a lot of field experience, so I think you can really testify to the power of the modality in orthopedics and sports medicine and so on. So can you share specific examples or cases where MSK has played a crucial role in expediting diagnosis and treatment of MSK conditions?
Yeah, absolutely. So one of the biggest things with MSK ultrasound is that makes it really, really valuable is point of care. So for those of you who aren't familiar with that, it's the ability to perform a rapid diagnosis at the bedside. So basically being able to like see the patient, have an order from a doctor, talk to the patient at the bedside, see what their symptoms are, and then tailor your exam to fit the needs of the patient. And this gives you the ability to perform a rapid diagnosis and decide treatment. And depending on what the diagnosis is, you might be able to perform the treatment right then and there at the bedside because so many types of different interventional procedures can be done under ultrasound guidance. So with sports medicine, point of care is really big with athletes throughout the season. Their team physicians are going to be trying to make sure that they're healthy. If they get injured, they're going to want to do imaging right away to see if they're healthy enough to go back in the game. Or this can even be done at the sideline because of the portability of ultrasound. So this is really emerging in sports medicine as is being able to give that diagnosis and decide whether they can go back in the game. And then same thing with orthopedics. They're doing a lot of different types of interventional procedures. So they can do the ultrasound at the time of the appointment and decide what's going on and decide what course of treatment. As far as like some more specific examples, a lot of a common type of referring physician for MSK is rheumatology. So one of the benefits of using power Doppler with MSK imaging is the ability to tell if there's active inflammation in the joints or the tendons. And this can determine for the rheumatologist based on your findings whether or not they need to start medication or adjust their medication if they're already on it. So this is a rapid situation for them that they can go decide right then and there based on how it looks. You might also have a patient come in that has a tendon tear, and you can quickly determine whether the tear is partial or full thickness and decide whether or not they need some sort of surgical intervention or whether it's fine to have a more conservative type of treatment.
Right.
Also, ultrasound, a lot of sonographers are familiar with like different sonographic signs. So there's a lot of those in ultrasound. For example, like let's say a doctor thinks a patient might have gout or something like that. There's some different sonographic signs. One of them is called a double contour sign that's specific to gout. The tophi with gout have a snowstorm appearance, and then crystals are very specific for gout. There's like findings on ultrasound that directly point to this diagnosis. And then during your exam, you can actually aspirate the fluid and send it to the lab to confirm the diagnosis. But you can also avoid having to do unnecessary treatments too. Like if you don't see any signs of this, you can actually avoid having to give people unnecessary treatment too. And then one of the big benefits of ultrasound is the ability to perform dynamic real-time imaging with certain maneuvers. So this is big in MSK. Let's say someone has a click or a pop or a snap, you're able to have them reproduce it during your exam, and you can look at it in live imaging and just see what's popping, clicking, or snapping. Or you can have someone who has something like an injured ligament, and you can actually stress the ligament. You're using certain stress maneuvers and decide the degree of the injury. So all these different types of things are really valuable in performing a rapid diagnosis and deciding how to handle it.
I mean, incredible. I mean, the way that it just enhances, right, the view of the doctor. Like you alluded to earlier, really, I think is the future. It's something that I think more and more practices are jumping on because of the way that, I mean, it just enhances patient care overall. If you can avoid an unnecessary treatment, that in itself is a win. That plus all the other things that you mentioned. Point of care ultrasound truly is incredible, right, with its portability. You can't move a whole MRI machine to a football field. So being able to do that, you know, in sports medicine, that really opens the door for something more rapid, just so much better. So it is really important. It does bring a great value for sure. Now, technology is changing quite rapidly. I mean, we hear a lot about AI nowadays, especially for radiology, medical imaging as a whole. AI is the talk. So could you just give us a kind of an update on what's going on in MSK Ultrasound? I know you mentioned point of care, but what are some of recent technological advances that you've seen over the past, decade as you've been working in this? What have been some major changes? Could you tell us more about that?
Sure. The first one that stands out to me is the transducers, because this is something that really matters with MSK imaging. It never ceases to amaze me every time I demo a new machine or try a new machine, like the amount of new transducers that have come out. So a couple different things. One of them is how high the frequency has gotten. So I've seen transducers even with the frequency of 33 megahertz, where you can see every little detail in like a tendon, in a nerve, everything. So if you're looking for subtle findings, I mean, the transducers do it for you. I mean, you obviously have to have the know-how and you have to have, the correct application, but the transducers have just become incredible. And then also the size of the transducer. So we went from having big bulky transducers to now having these hockey stick transducers that really help get around the different bones in the ankle and foot and the elbow and wrist and hand, that you can really avoid getting dropout and get that level of detail. So that's one of the biggest things I've noticed. Definitely the Doppler is coming a long way. So it used to just be the next step up from color Doppler was power Doppler, which it's really, really important in MSK imaging, as I just mentioned with hyperemia and to look for active inflammation. Almost always with MSK, you're using the most sensitive color possible because you're looking for inflammation in the tendon sheath, in the joints, different things like that. So you want to use the most sensitive Doppler possible. So now you have power Doppler, microvascular imaging. There's all these crazy settings coming out where you could pick up the most subtle findings. Also, I've seen a system come out with 3D reconstruction that makes it look like a CT. So now you're able to like build these 3D images on ultrasound that I think are going to kind of have some crazy applications in the future. And then probably another important one is just the way that you're able to extend the field of view with it's called different things on different systems, but extended field of view or panoramic imaging gives you the ability to kind of follow a structure for a long period of time and construct a very large image. Wow. So this is very helpful with MSK imaging. So because let's say you have a tear and you want to show like where it is relative to a landmark for a surgeon, you can say, let's say the Achilles tendon tore and it's, 8 centimeters from the insertion or something. You can take a picture of the whole entire Achilles tendon and show exactly where it is so that the surgeon knows exactly where to go. Or you can also show how the structures look relevant to another. So if something is, enlarged or more hypoechoic or more hyperechoic, you can extend your field of view to show the surrounding structures so that it's more obvious to the reading physician these findings that you're seeing in real time. So all of these type of things are really helpful with MSK.
That's fascinating. I mean, I can't imagine what the next decade holds for us, because I'm sure that the advancements you just described, even though they're incredible, really are just the tip of the iceberg, right? Now, to talk a little bit more and give the audience more insight into just how the direction that MSK Ultrasound is moving, what are some emerging trends that you foresee that are shaping the future of MSK imaging? Because you're very involved in education, you're visiting a lot of sites, you're training a lot of people, so I feel like you have a lot of field knowledge you could share with us.
Yeah, one of the ones that you just mentioned that I could elaborate on is the portability of ultrasound. So a huge thing that comes up all the time now is handheld devices for ultrasound. So this is something that, there's still a lot of room for growth in this area as far as like making a system that rivals a full-size system. But this is like everybody's doing this. Everybody's trying to make the best version of this. Everybody's trying to make, transducers that can pick up the findings that are necessary for MSK imaging. But this is opening up a whole new world for people being able to connect a transducer to like your cell phone or your iPad or like, a smaller ultrasound system. I think in the next few years, it's going to explode because it's already coming up. It's just a matter of like people perfecting to make sure that you're not basically compromising the resolution by doing this. So you've got to make sure you're not using it and not providing as good of a diagnosis as you would with a full-size system. So that's my only objection to it at this point is like, having the technology meet the standard that it needs to, but everybody's working on this. You had also mentioned AI. This is a big one that I think we don't even know where it's going to go, but right now it could be used for image acquisition, to annotate the images. It can be used to interpret and the reports and generate reports. So it's a little scary, honestly, to see like what kind of people's jobs it can replace, but I think it could be also used in some really beneficial ways too. And I think elastography is a big one that's coming up. It's already being used a lot for the liver, but it's also emerging in MSK ultrasound to be able to measure the tissue stiffness to detect early tissue changes that aren't visible yet on ultrasound. So this might be really helpful for athletes in the future to kind of predict whether or not like a certain area is vulnerable to injury, or also if you have someone that maybe has a degenerative muscular disorder, you might be able to track over time the stiffness of the muscles to kind of see like the progression of a disease. I also think like virtual reality is going to come into play at some point. I'm seeing this more kind of in more in like the surgical field of being able to like look at things, but I think that virtual reality is going to come into play like in everybody's field, to being able to like, see things through the virtual glasses. I think a lot of people this is something I have explored and I think will continue to evolve is virtual training. So a lot of manufacturers are coming up with systems where someone could be across the country and you're giving them hands-on training. So there's ones where you can actually put cameras on you and connect to your ultrasound machine and your computer, and people can have different views of, like, one is like of your hand, one is of what you're working on the machine, the knobology, one of them is your ultrasound image, and then you can actually watch someone on the other end of what they're doing and have a conversation correcting them. So virtual, I think that kind of world opened up during COVID of people trying to figure out how to do virtual training. And then I think also for training, people are using like phantom models where they're very expensive right now, but hopefully that'll continue to evolve, but using phantoms instead of live models for training. And then I think as far as treatment goes, regenerative medicine is really big in MSK. So there's so many different types of injections available that can avoid surgery. Some of the common ones are like PRP and stem cells, but this is another area of MSK that's exploding of people trying to come up with better ways to treat musculoskeletal conditions without doing surgery. And then now I think a lot of practices are kind of integrating and having it be where you can have a physician, a nurse practitioner, and a physical therapist all in one place. So you can get all these services in one place. So that's kind of where I see the future going. A lot. It falls under a lot of people's licensure right now to be able to perform MSK ultrasound, which is why I think it's becoming so popular that so many different types of clinicians are able to perform it, and it's kind of just a race to see who can, kind of get ahead of it to get the patients. And I think it's really interesting to see like where the future is going to go with it.
Yeah, a lot of exciting developments. I mean, you mentioned the VR companies. It's funny you mentioned that because at the beginning of the month, I was at UltraCon from the IUM, and there were several VR companies there. And to be honest, it wasn't something I had really thought of or associated with ultrasound, but a lot of them were there for that purpose of what you're saying of training and simulating, a lot of simulation. And it's incredible how we've advanced because they were really elaborate simulations. And I can only imagine that in the years to come, that's going to continue. One follow-up question on the portability, though, because this is a trend that there's a lot of wireless ultrasound companies. And, have you yourself used them? Are you a fan, or you just think that we still have to wait a little bit? Have a lot of practices that you've been at, have you seen that a few of them or a lot of them have been like considering this for MSK specifically, or you think we're just not there yet?
I think a lot of people are already using it, primarily not radiology so much as orthopedics, physical medicine and rehabilitation, physical therapy. They're using it a lot because if you think about it, imaging is just one small part of what they do. So it could be a budget issue. It could be a convenience issue. Like I said, sports trainers are doing it like on the sidelines. I think I have used a few because I always want to give the best training course possible. I have a tendency to veer towards the full-size systems for my training courses because I don't want to compromise the quality when I'm giving a course. But I have seen a few, but I personally still think we have a ways to go as far as being able to use it to replace a full-size system. I think for injections, it's fine for like some of the larger structures. I think for like maybe some of the bigger structures like shoulder or hip where like the, you don't need to see like as much tiny detail. When you start getting into the really small structures, I think that we still have a ways to go, but I think it's moving really, really fast. So I don't think it's going to be long.
That makes sense. No, I don't think it'll be too long for sure at the rate that we're moving. But it makes sense how, there's still some room to grow. I mean, it's already a big advancement to be able to do it wirelessly. Crazy that, there's no big, machine attached. So we've already come a long way, but I think probably soon we'll get there. Well, Jamie, this has been an enlightening conversation. I really appreciate you taking the time to walk us through the world of MSK ultrasound. I'm sure anyone who listened through this finds it exciting. hopefully some people who are considering take that jump. I think that definitely you're right in saying that it is a part of the future for sure, in several specialties. Yeah.
Well, thank you. For those who are interested in getting their journey started, if you ever need any advice, please feel free to reach out to me. I'm happy to give any advice. And my website, learnmsksono.com, has a lot of training options. And I also do free content every week on Instagram and Facebook at Learn MSK Sono. I do Tuesday Tips with Jamie, where I'm always giving out free education. So if anybody's just looking to start somewhere and just kind of wants to get their feet wet, take a look or reach out if you ever need any advice. I'm a sonographer and I know what it takes to kind of get there, and I'm happy to help my peers and kind of help move the community forward.
Absolutely. And we will be putting the link to your website in the show notes, in the caption, in the article itself, transcript, just so that people can have easy access to it. So definitely go to Jamie's website. I know you have a whole lot of info there already for free. So definitely it's a great resource. So thank you again. Thank you so much, Jamie.
Thank you.